In symptomatic, previously treated Waldenström patients, we recently published the update of the pivotal trial. This was the trial that actually supported the approval of Ibrutinib monotherapy in patients with Waldenström's, both in North America as well as in Europe and across many, many other countries. In this report, we now had 59 months of median follow-up, which was considerably more than the 2-year follow-up that we originally had when the study was published in the New England Journal of Medicine in 2015. And what we learned with this is that the depth of response, particularly VGPR attainment, did go up over time with Ibrutinib. We did once again see differences based on both MYD88 and CXCR4 mutation status. Those patients that had a MYD88 mutation showed high levels of activity versus those patients that were MYD88 wild type. And among the individuals that were MYD88 mutated, CXCR4 also impacted response. There were less VGPRs in the patients that were double mutated versus MYD88 alone. In fact, if you look at the VGPR rate, it was 5 times greater if the patients only had the MYD88 mutation and not the 2 mutations together. And even the time to attainment of a major response was much shorter, by about 3 months, in fact, for those patients that were MYD88 mutated alone. And this may be clinically significant because if you keep in mind, getting responses and getting them quick is very important in our pharmacotherapy of this disease. Now, what we also learned was that progression-free survival was actually, the median was not reached at 5 years, which is wonderful news. At 5 years, in fact, it was 54% of the patients were still progression-free. 87% were alive. This is important when you think about the median prior therapies was 2, and 40% of the patients were refractory to their previous therapy. But here too, MYD88 and CXCR4 mutation status impacted progression-free survival. We saw, in fact, that 70% of the patients were still progression-free at 5 years if they only had the MYD88 mutation. If they had both mutations, the median PFS had been reached at 42 months, which is still, if you think about it, very, very exciting given the heavily pretreated nature of this population. And those that were MYD88 wild type, most progressed, very, very early on in the trial. So a lot to actually digest from this trial, but I think the take home here is that genomics do impact response to BTK inhibitors, in particular Ibrutinib from this study, and that Ibrutinib is actually very, very active in this population of previously treated Waldenström patients.